Hey, Sharman, I can't hear you. We believe in a program that was established by our Vaccine Advisory Board that the two fundamental objectives with respect to vaccination priority here in Massachusetts should be the preservation of life and the preservation of the healthcare system that preserves life. And that's why we targeted a number of the communities that we targeted to begin with. We also said we wanted to make clear that equity would be an important focus for how we move forward. And if you think about many of the groups that we focused on, which most other states didn't, straight out of the gate, it's pretty clear that we took that idea seriously. There are very few states that chose to vaccinate straight out of the gate residents and staff at congregate care facilities that serve homeless people, folks with developmental disabilities, or folks with mental health issues. Very few states, I'm not sure of any, that chose to focus straight out of the gate on personal care attendants or on home health care workers. Very few states straight out of the gate chose to focus on making sure that inmates and correctional officers in the correctional system had a chance to get vaccinated. And very few states straight out of the gate put the amount of work and effort that we put into doing all we could to make sure that staff in senior care facilities, long-term care facilities, and assisted living facilities got vaccinated. And that all took time, but it was important work, and it made it possible for us to consistently overperform national averages on delivering doses to some of those most vulnerable populations. And it's part of the reason why 75% of our over 75 population, which is the most vulnerable population, has been vaccinated here in Massachusetts. And it's also why almost 50% at this point of our 65 and over population has been vaccinated here in the Commonwealth. We continue to believe that we should be focusing on preservation of life and preservation of the healthcare system. To align our program with the decision that the President made to include teachers and educators and educating staff and child care workers, we incorporated them into the current eligibility model starting today. And we set aside 4 days at the end of March and the beginning of April, when I'm hoping we will have a lot more J&J vaccine, which can be a 1-dose solution, or more of the 2-dose Pfizer and Moderna vaccine, so that those days can turn out to be very productive days for educators, child care workers, and K-12 staff. But I am not going to be in a position where I take vaccine away from people who are extremely vulnerable, who have multiple medical conditions and are over the age of 65, to give it to a targeted population. We're just not going to play that game. They were looking for their own vaccine and to not participate in the process that everybody else participates in. In addition to that, every state in the country is using provider organizations, mass vac sites, pharmacy chains, and community health centers for the vast majority of its vaccine distribution program. The Biden administration is using, through FEMA, is using mass vac sites, bigger mass vac sites than our mass vac sites, as well as retail pharmacy chains and community health centers to distribute its vaccine. The process we're pursuing here in Massachusetts is completely consistent with the process that's being used in virtually every other state in the country. Why? Because it's effective, it's efficient, and it gets lots of shots in people's arms in a short period of time. Say again? First of all, even the CDC has said that teachers don't need to be vaccinated to be educating kids. And by the way, tens of thousands of teachers and hundreds of thousands of kids have proven here in Massachusetts since August that if you follow the rules and the mitigation strategies that were developed by a panel of experts and pediatricians and educators, that our folks at the Department of Elementary and Secondary Education put together, you can teach kids safely in person. The Lieutenant Governor and I were up in Gloucester last week to celebrate the 101st day in a row of in-person education in the city of Gloucester. Now, Gloucester has done a terrific job of making sure that their kids throughout the school year have had access to in-person education. And Gloucester is a multilingual community. It's a community that had some very tough days, weeks and months associated with COVID. And because of the mitigation strategies that they put in place, and because of the guidance that they got from their own people and from the folks at DESE, they have succeeded. But they are one of many stories across the Commonwealth that demonstrate that if you follow the rules and you pursue the mitigation strategies that have been recommended by a whole variety of experts in the space, you can educate kids in person and do it safely. And that's all we're looking for. I can't speak to that, but what I can tell you is the Lieutenant Governor and I have been in and out of a bunch of schools over the course of this year. And the one thing I can say I take away from every visit that I've made, and I think the LG would agree with me on this, is the joy and the sense of gratitude that the kids and the teachers and the administrators feel toward one another about the fact that they found a way to make it work. And in many respects, that seems to me to be the greatest challenge of all. I mean, what Gloucester is doing is a little different than what Salem is doing, is a little different than what some of the other communities we visited have been doing. But the single common element that all these communities have that have had their kids in school all year is they've followed the guidance and the mitigation strategies, and they've been very creative about how to make it work in their building for their kids, their staff, and their teachers. Well, I certainly think that this idea of Archipelago and Healthcare for All are two very well-known organizations in Massachusetts that have done a lot of great work around outreach, especially as it relates to healthcare. I do think this whole idea of literally door-to-door type activity, sort of the equivalent almost of a political campaign, and working with key community-based organizations and faith-based organizations, trusted partners in those communities, has got to be a big part of how we reach people and then encourage them not only to get vaccinated, but if they say to us, I need a ride, or if they say to us, there's some other constraint that's associated with getting vaccinated, that we figure out what it is. If they say, I just don't want to go for another 30 days, that we create some sort of a tickler that makes it possible for us to get back to them 30 days later. The call center that you folks are running here with the 50% of the vaccines that you have available for people in the community, the outbound approach you've been pursuing, the way you've gone about doing that is certainly part of the strategy as well. But I think, I've said many times that I think guys like Alberto actually has a lot of really interesting ideas, which we've been busy stealing, about how to make this message deliver and how to make it work. But I also think that one of the things that makes many of us, including me and the Secretary and the Lieutenant Governor, so frustrated about where J&J is at this point and where we thought they were going to be, is they don't require the deep freeze and the overnight prep and the thaw process that's associated with the Pfizer and Moderna vaccine, which means, and it's one dose, which means you can use it on a mobile basis to visit community health centers, senior centers, senior housing. There's so many things you can do with a vaccine that doesn't require all of these very particular storage and prep issues that come with Pfizer and Moderna on a mobile basis. And the fact that it's one shot means you don't, when you're out there vaccinating at a senior center, or you're out there vaccinating at a community center, or you're out there vaccinating at a public library, you don't have to set up a second appointment for all those people, and you don't have to worry about whether or not you've thawed enough the night before, or you put enough, you mixed enough over the previous 2 hours to vaccinate people. And I really hope we do see a big J&J supply, because I'm sure these folks and the other folks who are working with a lot of these community-based organizations will have some really great ideas about how we can really leverage that, especially in some of the communities where people have a hard time getting to a provider, much less a site. Well, keep in mind that people need to be eligible, right, when they sign up. It's going to go online tomorrow morning. I'm not exactly sure when, so it's going to be online tomorrow morning, and people should just check the website, and it'll be there. There is a first come, first serve element to it, but remember, it's also going to try to make sure that it sends you to a place that's consistent with your geography based on available appointments at that location. Anybody who wants to register can register, okay? But the folks who are obviously going to be dealt with initially by the site will be those who are currently eligible. So take me, I'm 64, right? I'm not eligible. If I sign up tomorrow morning, I won't actually get into the queue, right, until I become eligible, which will be when my age group becomes eligible to get vaccinated. I think it's more going to be some sort of an algorithm, the way they'll tee it up originally for that, because I'm not eligible. I don't think it's going to work that way. I think if you sign up before you're eligible, you'll just get rolled into the process and identified. Do you know the answer to this? I'm going to have the Secretary, I'm familiar with the proposal. I'm going to have Secretary Sutter speak to it.
I think I heard most of that through the echo. So last week, this is Thursday, might have been the beginning of this week, we had a meeting with the Springfield COVID task force and some of their state representatives about the City of Springfield's proposal. It's exactly what we would want to see from the 20 disproportionately impacted communities, like their ideas about how to bring vaccine to their community. In fact, we're reaching out through Curative to the city about opportunities to partner together. And the city, all the disproportionately impacted communities get an allocation separate from all other allocations of vaccine, from 400 up to 1,000. City of Boston gets 1,000 because it's obviously the largest city, to also start to plan how they want to use the vaccines. The city wants, I think, double what they're currently getting, and again, we have this constraint of supply. So looking for the CIC model here at Reggie Lewis is one that we're taking the lessons here to talk to some of the other mass vac sites about opportunities to reach out to their communities as well. So as the governor often says to you, more to follow soon.
Say again, Matt. I think, well, I mean, every state is pursuing a different approach to this. The one thing we don't want to lose sight of with respect to what we do here in Massachusetts is this requirement to pay attention to the issues around equity, okay? And I think that's going to be something we'll continue to discuss with the advisory board that we've been working with on this. But part of the reason why it's set up the way it's set up was to answer questions and to be sure that we have programming and prioritization in place to deal with some of the communities and some of the people in those communities and some of the people in particular roles of employment that have been hardest hit by this to begin with. Who's follow up on the meeting? Yeah. Yeah, I mean, one of the things we're trying to figure out here is, and we now have more practical experience, which helps, is, you know, how much of these various communities will come because it's available. How many of these folks need to be sort of courted a little bit with respect to getting them there? And then when do you really get to the point where you can move to the next group and feel like you got everybody who was up for it in the group that was already eligible? And we're starting to figure some of that out. But with respect to whether, you know, somebody who's my age or somebody who's 25, I don't think the way ours is set up it would work that way. And I certainly think that when you get to the everybody group, which is that what you're talking about, like when everybody's eligible? Well, remember, hopefully by then we're going to be at a point in time when if we can choose to believe a lot of what we're told by the feds and others, by the time we get to that point, there should be enough vaccine available for us to really max out the capacity we have, which means the distance and the time between, you know, when that group were to start and all the folks who are in it get vaccinated probably wouldn't be that long. Again, it's going to depend a little bit on whether or not we think that's creating issues around equity. And remember, the preservation of life issue for the over 65 population and people with serious medical conditions is a really big deal, and that's why we started there, along with some of those key healthcare communities and some of those congregate living populations where both the residents and the staff were people that we considered to be significantly at risk. Well, it's certainly not. I certainly don't do it every year because it looks good. The Granite Telecommunications down in Quincy started doing a shaving event to raise money for cancer research at Dana-Farber. And I knew the CEO there because I used to work in the neighborhood, basically, when I was at Harvard Pilgrim. And he asked me after the governor's race if I would be willing to come down and participate in this thing. And he said, if you do, we'll make a big donation to the program if you choose to participate. So I did. And, you know, there are literally thousands of employees of that company and family members of employees who do this. And they've raised more than $50 million doing this over the course of the last 7 or 8 years. And this year they're doing it virtually. And they think they're going to raise $7.5 million for Boston Children's Hospital. And my experience this time was a lot different than it was last year. It was just me, Kevin Churchill, who's the CEO of Boston Children's, and Rob Hale, who's the head of Granite Telecommunication. The three of us, socially distanced, in the same lobby where usually there's hundreds of people and hair cutting and you know, buzz cutting going on all over the place. But they're still going to raise a lot of money this year. And I know this doesn't look very good, but it doesn't look very good for a short period of time, and it grows back. And it's a moment and an opportunity for those of us who, thank God, don't have cancer, to understand what it might be like to have cancer and to lose all your hair and to end up in a situation where you feel a little uncomfortable about the way you look. So I don't mind doing it. I like doing it. No, we're looking to have people go sort of in the order that they sign up. I mean, like I said, 75% of the over 75 population at this point has gotten a first dose in Massachusetts and obviously been scheduled for second doses as well. And I think in most states that have done a pre-registration model, I mean, they vary a lot from place to place, but people generally, you know, work their way through these groups, and when they get to the point where they feel like everybody who really wanted to get one, they move to the next group. And if folks do want to hop in at that point on a pre-registration, they can, but then they just land in the list, the same place they would have landed otherwise as an eligible beneficiary. Say again? I don't know. It depends. I mean, they'll start making, remember, they're going to start rolling these out next week. And so they'll probably start booking things sending out notices to people the beginning of next week for the end of next week, and then rolling forward from there. The other thing I would remind people is there's still a bunch of other places that are going to continue to vaccinate people in Massachusetts. You know, hospitals and health systems are the largest player in our vaccine distribution system in Massachusetts. The regional collaboratives and other sort of locally operated initiatives are still going to do 65,000 vaccines a week. The community health centers are going to continue to do significant numbers of vaccinations, and there's a bunch of different places, and the pharmacies are going to do almost 100,000 next week. So there are a lot of other places and channels through which people will continue to get vaccinated in Massachusetts. We've been talking to the neighboring states about this, and I expect that there will be, you know, news movement, whatever you want to call it, on that relatively soon. We did adopt the CDC guidelines on travel for those who've been vaccinated, I think this morning or last night. Yeah. Say again? I think if people want to check it when they get up, that's a fine idea.
Thanks, everyone.
Thanks. And thanks again to Reggie Lewis and to the folks at CIC. Really appreciate it.